The doctors could not believe it. After years of prescribing medications to relieve chronic pain in older adults, many found themselves confronted by a surprising discovery. A simple cooking oil, easy to obtain and used for generations in some cultures, proved more effective at easing leg pain than various pill-based treatments. This is not a fad or a superstition, nor is it a trick without scientific basis. What you're about to discover is supported by medical observations, recent studies, and real testimonies from older people who, like you, were seeking relief without side effects. And they found it in an unexpected place, their own kitchen. If you're watching this video, you have probably also felt that stabbing discomfort when walking, that constant heaviness in your legs, or that burning sensation that appears just when you want to rest. You may have tried creams, medications, or massages, but the pain remains, like a persistent shadow that won't let you enjoy your days. In this video, I will tell you what this miraculous oil is, which is not as miraculous as it seems, how to use it safely and effectively, and why its effect surpasses that of many conventional analgesics. But beyond the oil itself, I want you to discover a new way to care for your body without relying solely on pills or medical prescriptions. And if you're wondering whether this is for you, I'll tell you. If you are over 60 years old, if you have ever felt pain climbing stairs, if your legs feel tired at the end of the day, or if you simply want to improve your quality of life, then stay with me until the end. This could make a real difference in your day-to-day routine. Before we continue, I want to get to know you a little better. Tell me in the comments how old you are and if you have ever felt leg pain. I would love to read your replies. At a certain age, there are pains that become part of everyday life. Some appear quietly, others arrive suddenly, but almost all end up affecting more than just the body. They affect the way we live. Leg pain is one of the most common complaints in people over 60 years old. But the most frustrating thing isn't just feeling it. It's not really knowing why it's there. Many are told it's normal, that it's age. But that is not an explanation. The body always speaks to us, and pain is one of the ways it does so. Today, we are going to listen more closely. One of the most frequent causes of leg pain is poor circulation. Over the years, arteries can harden or narrow, making it difficult for blood to flow properly to the extremities. The legs feel heavy, cold, or sore after walking just a few minutes. Another cause is chronic inflammation, a silent condition affecting millions of older adults. Although not always visible from the outside, it generates internal pressure in the muscles, joints, and tissues. It's as if something inside us is constantly irritated and aching for no apparent reason. There is also joint wear. Over time, the cartilage that protects our joints is gradually lost. The knees creak, the ankles hurt, and each step feels less steady. It is common for this to lead to constant pain that worsens at the end of the day. And finally, a cause that few mention: compressed nerves. When the nerves running through our legs become trapped by tense muscles or displaced vertebrae, the pain can radiate from the lower back to the feet. It isn't always a sharp pain, but it is constant, annoying, and sometimes accompanied by tingling or numbness. I want to tell you now about Mrs. Clare. Mrs. Clare is 78 years old. For more than a decade, she lived with pain that began in the morning, the moment she put her feet on the floor. She said it was as if she were walking on invisible stones. She tried creams, changed her shoes, took medications, did exercises, and nothing worked. They told her it was normal, that it was just time passing. But Claire did not accept it. She wanted an answer. She wanted to walk without pain, without depending on yet another pill. And like Claire, I know many of you have tried everything. Pills that do nothing, expensive treatments, useless advice, and yet the pain remains. If you too feel this way, if you have done everything possible and nothing seems to work, keep listening, because what we are about to discover could give you new hope. For a long time, we were taught to trust pills completely. When something hurts, you take one. When something swells, you take another. And for a while, it seems to work. But over the years, that habit can create more problems than it solves. Commonly prescribed analgesics and anti-inflammatories, like those ending in profen or those bought over the counter, can relieve pain in the moment, yes. But they can also have side effects that accumulate with continuous use. One of the most frequent is gastrointestinal damage. Many older people develop gastritis, ulcers, or chronic stomach discomfort from taking these medications every day, often without realizing it. Another significant risk is increased blood pressure. Some medications cause the body to retain fluids or affect kidney function, silently raising blood pressure, until it becomes a problem. And let's not forget dependence. We are not just talking about addiction, but something more common. The body getting so used to the pill that it no longer works as it once did. Some people start by taking half a pill a day and end up needing 3 or 4 without achieving the same relief. It is a trap many do not see coming. Now, I want to tell you about Mr. Raymond. Mr. Raymond is 81 years old. He was a farmer all his life, a strong and hard-working man. But over time, his legs began to ache. At first, only when walking, then also when standing, and eventually even when sitting. He started taking painkillers every day without missing a single dose. At first, the relief was almost immediate. But after a few months, he began to feel stomach discomfort. Then he noticed that his blood pressure, once stable, surged for no apparent reason. Finally, his doctor said something he did not expect to hear. "Raymond, you can't keep taking these pills." And that was when he felt lost. What was he supposed to do if he could no longer take the only thing that eased his pain? Like Mr. Raymond, many people find themselves at that crossroads. They don't want to suffer, but neither do they want to continue harming their bodies. And that's where an idea long ignored comes in. Natural alternatives. We're not talking about stopping medications without medical supervision. We're talking about adding options, exploring methods that cause no side effects, turning our gaze towards simple, accessible, and often forgotten remedies. Because sometimes the relief you seek isn't in a new chemical formula, but in something much simpler, something you may already have in your kitchen. In the next part, I will tell you exactly which oil has even surprised doctors, what makes it special, and how it can help you regain mobility and well-being without harming your body. When we think of cooking oils, most of us imagine olive oil, sunflower oil, or perhaps corn oil. But there is one that, although little known in many Spanish-speaking countries, has been used for centuries in other cultures. Not only for cooking, but also to soothe deep aches: mustard oil. Yes, you heard that right. The very oil that in India or Bangladesh has been used for generations, not only to prepare flavorful dishes, but also as a home remedy for muscular, joint, and circulatory pains. And the most surprising thing is that what was once just Granny's tradition is now being backed by science. Recent studies have shown that mustard oil contains natural compounds with anti-inflammatory and circulation-boosting effects. Among them, one stands out: methyl salicylate, a substance that acts very similarly to aspirin, but applied directly to the skin. This compound helps reduce local inflammation, relieve muscle tension, and improve blood flow. This is not about taking it by the spoonful or adding it to food for this purpose. The key is in how it is applied. In traditional Ayurvedic medicine, the oil is warmed slightly, just a little, never too much, and massaged gently over the legs, especially in the areas most affected by pain, such as the calves, knees, or ankles. By doing so, you not only nourish the skin, but you also activate circulation, relax muscles, and eliminate that constant feeling of heaviness or burning that so many people experience at the end of the day. A trial conducted on older adults with chronic joint pain showed that those who used this oil topically for 3 consecutive weeks reported a noticeable improvement in morning stiffness, a visible reduction of inflammation, and above all, greater ease walking without discomfort. Now you may be thinking, why had no one told me about this before? Well, that is the big question. Because often simplicity is overlooked in favor of what is more complex or more expensive. But the truth is that this oil, available in natural food stores or international markets, can be a powerful tool to complement your care. It is not magic, it is not a miracle, but it is a real, proven, accessible alternative. And the best part, with no serious side effects. In the next part, I will tell you exactly how to use it correctly, when to apply it, how often, and what precautions to take to reap all its benefits without unnecessary risks. Because knowledge is only useful if we know how to put it into practice. Why does it work better than many pills? A simple scientific explanation. When it comes to pain relief, most people immediately think of taking a pill. It is the quickest thing to do, what we have always been accustomed to. But as the years go by, our body changes, and what helped us before can now harm us. This is where mustard oil, or similar natural oils, begins to stand out. Because it does not enter through the mouth, it does not pass through the stomach, nor is it filtered by the liver. Its action is direct, localized, and that is precisely why it can be more effective in certain situations. Let me explain how it works, in simple terms. When you apply the oil to your skin and massage it, you are not just relaxing the muscles. The warmth of the massage, combined with the natural properties of the oil, stimulates microcirculation. This means the blood begins to flow more vigorously in that area, delivering oxygen and nutrients to tissues that are often inflamed, weak, or poorly oxygenated. But in addition to improving circulation, these oils contain active anti-inflammatory compounds, such as allyl isothiocyanate and the aforementioned methyl salicylate. These penetrate the skin and reach nearby muscles, tendons, and nerves. There, they reduce inflammation, soothe compressed nerves, and help relax the area naturally. Now think of an anti-inflammatory pill. Yes, it can help with pain, but it has to pass through your digestive system, through the liver, and then be distributed throughout the body. That means only a portion of the medicine actually reaches the painful area. Meanwhile, the stomach, kidneys, or blood pressure may be affected. In fact, many older adults have had to stop taking certain medications because of digestive problems, ulcers, or high blood pressure. And then they face a dilemma: endure the pain or risk their health. That is where topical solutions, like this natural oil, can make all the difference. They do not carry the side effects of drugs, they do not create dependence, and they can be used frequently as long as a few basic recommendations are respected. One of the things I hear most from older people is this: I want something that relieves me, but doesn't damage me from the inside. And that is exactly why remedies like this deserve to be known, tried, and valued. Because it is not about replacing everything you already know, but about expanding your care options. Now that you understand how the oil works in your body, in the next part I will teach you step by step how to apply it correctly, when to use it, how often, and what to avoid to achieve the best results without risks. Let's move forward together toward that goal. How to use this oil step by step, a safe home routine. Now that you know why this oil can help you, it's time for the most important part: how to use it correctly at home. You don't need any special equipment or to spend money on expensive products. You only need the oil, a small container, your hands, and a few minutes of peace. Here's your step-by-step routine. Step 1. Warm the oil gently. Place a few tablespoons of mustard oil or another oil with similar properties in a small glass or ceramic bowl. Then set that bowl inside a larger one filled with hot water, just like a bain-marie. The idea isn't to boil the oil, just to warm it so it feels pleasantly tepid. If you test it on your skin and it feels too hot, let it cool for a few seconds before applying. Step 2. Find a quiet spot and get comfortable. You can do this on the bed before sleep or seated in a chair with back support. Make sure your legs are uncovered and dry. Step 3. Apply the oil with gentle circular motions. Start at your ankles and slowly move upward toward your knees or thighs, wherever you feel the most discomfort. Use the palms of your hands, applying firm but painless pressure. Step 4. Massage for 5 to 10 minutes per leg. Focus on the tightest areas or where you feel heaviness, burning or stiffness. If the oil absorbs quickly, add a bit more. The goal is soft, well-hydrated skin, not drenched. Step 5. Elevate your legs for 15 minutes afterwards. Prop them on a pillow or rest them against the wall while you lie back. This boosts venous return and enhances the massage's benefits. During this time, breathe deeply and let your body relax. It's your moment. Important safety tips. Don't apply the oil to open wounds, cuts, or irritated skin. If it's your first time, test a small patch on your skin to check for any reaction. Avoid contact with eyes or mucous membranes. If you have very sensitive skin or a dermatological condition, consult your doctor first. When is the best time to do this routine? Most people perform it at night before bed. That way your body can fully unwind, and you avoid any activity that might negate the massage's effects. But you can also do it in the morning if your legs feel stiff upon waking. And the best part, you don't need to do it every day. Start with 2 or 3 times a week and see how your body responds. Some notice relief in the first week, while others need a bit more time. The key is consistency. Extra tip. While massaging, or right after, practice deep, slow breathing. Inhale through your nose to the count of 4, and exhale through your mouth to the count of 6. This calms your nervous system and reduces stress, which often worsens pain perception. Now that you know how to do it, let's look at when not to use this oil and common mistakes to avoid, so you can have a safe and beneficial experience. When not to use this oil and what to avoid. We've talked about the benefits, how it can relieve pain and improve circulation naturally. But there's one thing we must never forget. Not every remedy works the same for everyone. Before you rush to try this, pay close attention. Being responsible with your health also means knowing when not to use something and when to consult your trusted physician. First, if you have very sensitive skin or a skin condition like psoriasis, dermatitis, or frequent allergies, do a patch test before applying the oil more widely. Put 1 drop on your forearm, wait 1 hour, and watch for redness, itching, or irritation. If any of these appear, don't use it. Second, if you have advanced diabetes or skin sensitivity issues, proceed with caution. Some people with diabetic neuropathy can't feel heat or pain well and might burn themselves if the oil is too hot. In these cases, always check with your doctor before trying anything new. Avoid using this oil if you have open wounds, recent bruises, acute inflammation, or fever in your legs. In those situations, any massage could worsen things. Remember, this oil is for mild to moderate chronic discomfort, not for treating serious injuries or infections. And this is crucial. Never replace a medical treatment without talking it over with your healthcare professional. The oil is just one more tool. It may help you feel better, reduce medication use, or ease those nights when pain keeps you awake. But it does not substitute for a medical diagnosis or necessary therapy. Think of it this way. Natural solutions work best when used wisely, as a complement to all the care you're already giving your health. They're there to support, not replace. If you have doubts, if you're on medication, or have important medical history, please talk to your doctor before starting. Don't be afraid or embarrassed to ask. Every body is unique, and your peace of mind is worth more than any trend or tip. After covering studies, science, and the step-by-step routine, I want to share the most important thing. Real voices of people just like you, living with leg pain day after day, who decided to try something different. These aren't empty promises or miracles. They're real, tangible improvements that made a big difference in their quality of life. The first story is from Mrs. Teresa, 75 years old, from Guadalajara. "I couldn't sleep at night anymore," she wrote. "Every time I lay down, the pain in my calves was unbearable. I took pills, but they gave me heartburn. Then my granddaughter bought me a little bottle of mustard oil. I started doing gentle massages before bed, and in 1 week, I noticed I slept more peacefully. Now it's part of my routine. It's so simple, yet it has given me my rest back." Next is Mr. Ernest, 80 years old, from Buenos Aires. After walking 10 minutes, my legs felt as heavy as if I were carrying sandbags. I began using the oil on a friend's recommendation, and at first I was doubtful, but I rubbed it in every single day. I'm not saying I'm running marathons now, but I can walk for an hour without having to sit down. For me, that's a miracle. We also heard from Lucy, 69 years old, from Medellin. I've had circulation issues for years. My ankles would swell every afternoon. What surprised me was that after applying the oil for 1 week, the swelling went down faster. Sometimes I forget about the pain, and that hadn't happened in a long time. What's most interesting in these cases is that each person found a different benefit. For some, it was better sleep, for others, reduced swelling, and for some, regained mobility. Not everyone experiences the same result, and that's important to acknowledge. But they all share one thing. They felt a real difference, a relief, a small respite. And for those who've dealt with pain for years, that means everything. They also all agree on one thing. They didn't replace their medical treatments. They complemented their care with this simple, natural practice. In doing so, they felt more in control of their bodies, more connected to their health, and more capable of living with fewer discomforts. So if you're looking for an option that doesn't rely on a pill, that you can do at home, and that gives you a bit of peace, maybe this is what you needed to discover today. Part 9. Final recommendations and complementary tips to relieve leg pain. Now that you know about the oil and how to use it properly, I want to share some additional recommendations that can make a huge difference if you apply them consistently. Because relieving pain isn't just about what you put on the outside, it's also about how you care for your body from the inside. Stay well hydrated. Your body needs water to keep tissues flexible, flush out toxins, and maintain proper blood flow. Many older adults drink little water for fear of frequent bathroom trips, but that only worsens the problem. Try sipping small amounts throughout the day, even if you don't feel thirsty. Your body will thank you. Avoid staying in the same position for hours. Sedentary behavior, sitting or lying still for too long, is one of your leg's worst enemies. If possible, stand up now and then, even just to stretch or walk around the house for a few minutes. If you sit a lot, try elevating your legs slightly and rotating your ankles in circles. Move gently, every day. You don't need intense workouts. Simple stretches, slow walks, or even circular leg movements while seated all help activate circulation, keep muscles flexible, and reduce pain over time. Watch your diet. An anti-inflammatory diet can do wonders. Include fruits like pineapple and cherries, leafy greens, olive oil, oily fish like salmon, and spices such as turmeric and ginger. Cut back on ultra-processed foods, white flour, and excessive sugar. Your body needs clean fuel to repair itself. Mind your sleeping posture. Sleeping with your legs slightly elevated can improve blood flow overnight. You can also place a soft pillow under your knees to relieve lower back tension. Consider some natural supplements with doctor's approval. Magnesium helps relax muscles. Hydrolyzed collagen supports joint health. Omega-3 fatty acids fight inflammation. They don't replace a healthy diet, but they can be great complements. And finally, remember, don't expect a miracle overnight. The key is consistency, giving yourself a little space each day to care for your body with patience and love. Your body responds when you treat it with kindness, gentleness, and respect. I know sometimes it feels like everything hurts. Every step is a challenge, that the only option is pills or gritting your teeth. But that's not true. There are small gestures, simple remedies, and accessible tools that can make a big difference in your daily life. This oil I shared today isn't magic, and it won't cure you overnight. But it can help you feel better, rest more deeply at night, and reclaim that bit of well-being you need and deserve. Sometimes we forget that our bodies don't just need strong medicines, they also need care, attention, and touch. A patient massage, a calm bedtime routine, a deep breath. All of that heals too. Remember, Your health doesn't depend on one single thing, but on many small habits repeated each day with love and consistency. Now I want to hear from you. Have you tried any natural remedy for leg pain? Has anything worked for you, even just a little? Share your experience in the comments. I'd love to read your story, learn from you, and build a community of real, helpful advice together. And if this video or article helped you, if it gave you a new idea, or simply made you feel accompanied, please subscribe and share it with someone who needs it. Sometimes a simple tip can change someone's day or week. Thank you for being here. Thank you for caring for yourself. And thank you for continuing to learn at any age. See you in the next video.